So when we think about metastatic clear cell renal cell carcinoma, we really have an embarrassment of riches. So we have 3 different combinations that have been approved in the past 2 years with nivolumab, ipilimumab, pembrolizumab, axitinib, and axitinib avelumab most recently. And so how do we determine which regimen to choose and which patients get what? I think it's really an unanswered question. Overall, we try to do the cross-trial comparisons, which you're never supposed to do. We look at nivolumab, ipilimumab. I think that response rate is 40%. We have long-term follow-up on that those responses are durable. Those patients who have a CR with a 3-year follow-up, over 90% of them maintain that CR rate. CR rate was over 10%. When we look at the combinations of the TKI and IO, pembrolizumab, axitinib, or axitinib avelumab, response rates over 50%, with the overall survival benefit seen with pembrolizumab, axitinib, but not with axitinib avelumab. So taking all that into context, I think that for patients with good risk disease, I think I would definitely lean towards a TKI-IO combination in that front, given while the data is not as concerning initially with nivo-ipi, generally those patients with good risk disease didn't do quite as well with nivo-ipi. When we start thinking about patients with intermediate and poor risk disease, I think it involves a discussion with the patient about what toxicities, what lifestyle issues they're looking for. While nivo-ipi certainly has its rate of toxicities and need for steroids, at the same time it's 4 cycles of nivo-ipi and then maintenance nivo. When you start looking at the TKI-IO combinations, you're looking at indefinite TKI therapy. And so it really is going to involve a discussion with the patient on what their goals are and what's important to them. If they say, hey, I really want to do something that has the best chance for a complete response, then you have to really think about nivolumab and ipilimumab. If they're worried about that, or you're worried about managing IO toxicities from far away, maybe a TKI-IO. So it really involves a discussion, and it's a good problem to have.